Hi guys, welcome back to Codemaster Coach, your medical coding tutor. We're continuing our studies of the 2019 ICD-10-CM coding guidelines. Okay, we're down to 1B19 and we're down to D. All right guys, let's first look at the guideline. In the guideline, we're down to use of Z-codes. And the guideline states, Z-codes, which are other reasons for healthcare encounters, may be assigned as appropriate to further explain the reason for presenting for healthcare services, including transfers between healthcare facilities. ICD-10-CM official guidelines for coding and reporting identify which codes may be assigned as principal or first listed diagnoses only, secondary diagnoses only, or principal first listed or secondary depending on the circumstances. Possible applicable Z-codes include homelessness, inadequate housing, extreme poverty, persons awaiting admission to adequate facility elsewhere, unavailability and inaccessibility of healthcare facilities, unavailability and inaccessibility of other helping agencies, encounter for health supervision, and care of other healthy infant and child, encounter for respiratory, ventilator dependence during a power failure. And just wrapping this area up, it says the external cause of morbidity codes and the Z codes listed above are not an all-inclusive list. Other codes may be applicable to the encounter based upon the documentation. Assign as many codes as necessary to fully explain each healthcare encounter. Since patient history information may be very limited, use any available documentation to assign the appropriate external cause of morbidity and Z-codes. All right, Codemaster Coach, break this down for us. All right, the main thing I want to make sure I stress to you guys is that Z-codes are codes that we use when there are factors that influence healthcare status and contact. If I taught you that coding, we code what's wrong with your patient. What if nothing's wrong with your patient, but they're coming in to see your physician? Then what do we code? Z-codes. Think about if you go in, you're required for a job to get an examination or a physical. You're going to use your physician's healthcare services, but hopefully nothing's wrong with you. Now, if you go in for an examination and they find something wrong, then whatever's wrong becomes your principal diagnoses. But if you go in for an exam that's required for a job, for the Army, for a school, or whatever, it's still an examination and there's nothing wrong. Therefore, it's a Z code. So if you ever wondered, how do we code when nothing's wrong? It's a Z code. You're influencing healthcare services, so therefore we still need to code your services, but there's nothing wrong with you, so we use a Z code. Certain Z codes are designated as principal diagnoses, and others are designated as secondary diagnoses. When do I use a Z code as a principal diagnosis? To indicate aftercare. What if you've already gone in for a hip fracture, and with that they end up putting, or some type of hip injury, and they end up putting some kind of orthopedic device or some kind of pins that require you to come back in to have the pins or the orthopedic device removed? Well, in that case, when you come back in, you're not coming back in for that hip injury. You're coming in for aftercare type code. So that's a Z code. Or some type of special therapy. What if you've been diagnosed with some type of cancer and it requires chemotherapy or radiation therapy? Well, you already got your principal diagnosis when you went in, but if today you're coming back in for chemotherapy or radiation therapy, then that becomes your principal diagnosis, which then is a Z code to indicate for a specific reason, such as you're an organ donor. If somebody's going in to donate their kidney, nothing's wrong with them. They're going in to actually be a donor. Then that donor becomes a Z code because nothing's wrong with them to code wrong. We're just identifying the fact that they are a donor. Prophylactic care. What if they've got a condition that requires them to come in and have special treatments for that condition, but the reason for them coming in is for the prophylactic care? Well, then the prophylactic care is a Z code. Now, when is it used as a secondary code? When, for example, a patient does have or has a history of breast cancer or a family history of breast cancer, and they're coming in today for a screening. So in that case, your screening is your principal, but identify the fact that they have a personal history of or a family history of. Those are Z codes that we need to also put on the encounter form, because we're identifying the reasoning behind why they're having a special screening done. When there's a history of cancer in the family, for example, with breast cancer, it was 10 years. Every 10 years, go get a mammogram. They've got it down to 5 years. But if you have a family history of, they recommend that you come in and get a mammogram every year. If you have either a family history of or a personal history of breast cancer, then they ask that you come in annually. So in those particular cases, we like to identify the fact that, yes, she's coming in for a screening mammogram. No, she does not have breast cancer, but she does have a family history of or a personal history of. So your principal diagnosis is the screening, but secondary, we're identifying the fact of why you're coming in annually to justify that code. So those are the two reasons why you could have a principal diagnosis with the Z code. Again, when those are the reasons for you coming in. You're not sick, but you're using our healthcare services. Therefore, we have to bill for it, and all we have is a Z code to use. Or it's a secondary code when you're coming in for a particular condition, and then we're justifying why you're coming in the case of the screening mammograms. How do you look up these? If there's nothing wrong, how do you look up in your alphabetic index these Z codes? Go to terms like admission for, encounter for, history of, observation for, aftercare, or even just look up the main term problem or the main term status. So again, look up admission, examination, history, observation, aftercare, problem, or status. Those will help you find your Z codes. And I like to always end my videos with giving you some examples to code. So for Z codes, some examples that I have for you to code are number 1, visit to change surgical dressing. Number 2, family history of polyps of the colon. Number 3, status post aorta coronary bypass procedure. Number 4, encounter for gastrostomy tube irrigation. And number 5, non-compliance with medication unintentional due to patient's advanced age. So as you look at each one of these, like in number 1, what's wrong with your patient? Visit to change surgical dressing. There's nothing wrong with them. They're coming in to have some aftercare or something done because of or a result of. Number 2, they have a family history of polyps of the colon. And you need to identify that because of whatever condition they're coming in today for. So in this case, it'd be a secondary code. Number 3, status post-aortic coronary bypass procedure. Just letting you know. Their status post. Encounter, number 4, encounter for gastrostomy tube irrigation. It needs to be irrigated, cleaned out. Number 5, non-compliance with medication, unintentional, but due to the patient's advanced age. Okay, guys, try to code those. Pause this video here because I'm getting ready to give you the answers. And the answers are: number 1, Z48.01. Number 2, Z83.71. Number 3, Z95.1. Number 4, Z43.1. And number 5, Z91.130. Okay, guys, thanks. I will see you in the next one.